Our chance arrival in DC Acquaah on this particular Monday evening brought joyous news. We learned a baby girl had just been born to this man's family just minutes after our footsteps made acquaintance with the dusty earth. These rural Kokomba folk believed we had brought a good omen. So Daddy here, Fingma Tafawo, was happy to name the newborn after us. So in commemoration of TV3 coming here, they are naming the baby Acquaah TV3, which is right here.
I am very happy. This is my 8th girl. As soon as you got here, my wife delivered.
But the joy was short-lived. The traditional birth attendant kept going in and out of the hut, and the women around were making a fuss. We waited almost an hour to see the baby, and after some inquiries, learned the mother wasn't doing too well. The placenta, also known as the afterbirth, would not come out. Tadali, Acquaah's mother, lay bleeding on the cold floor of the hut. With our attention on Tadali's welfare, Fengma later told us he was trying to get a motorbike, desperate to take his wife to the hospital. We had to step in.
Are you ready? They're coming.
To just quickly rush her to the hospital. The car is over there. This is the only way they can carry her. She's too weak to walk, so there's no option but to carry her. The nearest health center from DC Acquaah is in Sang, some 15 minutes drive away, but of course we were in a rush to save a life. Tadali had almost passed out when we got to Sang. The nurses quickly took over. Tadali was said to be hemorrhaging from a retained placenta, a simple complication that can be handled with skilled care. But according to a Ghana maternal health survey, hemorrhaging accounts for 24% of maternal deaths in Ghana, about a quarter of deaths. TV3's involvement in this birth was over. We left Tadali in the care of Sang Health Center nurses. They would try to stabilize her. If she needed a blood transfusion, they would have to transfer her to the nearest district hospital. There are no blood banks in the country's community health centers. We were worried. The crew was unable to check on Tadali the next day, but a call from one of the nurses confirmed both mother and child were doing well. This is Tadali, 3 days after Acquaah TV3's birth. After having 9 children at home, child number 10 almost cost her her life.
Never delivered in the hospital before because I don't have any complications. It's always goes simple for me. So
I would have gone around searching for a motorbike to carry my wife to the hospital, but it was so fortunate that you guys came here and rescued us.
Surprisingly, she managed to go for prenatal care, but because she had given birth at home 9 times already without complications, Tadali didn't feel any different about this birth. The midwife at the Sang Health Center confirmed this, saying Tadali is not the exception, as most of the women in these parts do the same.
The problem is that she may like to deliver at home, to say she's brave in delivering at home, because there's a perception that it's only those who are, like we call them fearos. They fear that would deliver in the hospital.
Aside free antenatal care, birth at a health facility is free for women in Ghana. So is childbirth at home for these women just a matter of pride or superstition? Most rural communities in the north especially are a good distance away from each other. And for most of the rural poor, there's nothing like a taxi. It's mostly motorcycles or fully packed vehicles like this one, which travel the route from DC Acquaah to Sang. But this is what the midwife tells me when I ask about transportation difficulties to capable health centers.
Transportation to some people would be a problem, but for her in particular, you know, she's by the roadside. So we don't see why she shouldn't have gotten an easy transportation to come.
The 3 delays model is a major deterrent to Ghana achieving Millennium Development Goal 5. I could only cast my mind back to Fingma's distress when he went off to find a motorbike to transport his bleeding, almost unconscious wife to Sang. So we went to the Ghana Health Service to find out how the service is handling the issue.
It's a Herculean task because we have to be at around 185 per 100,000. Even that is not pleasant. We are currently at 350 per 100,000 live births. We have a long way to go. I mean, it won't be easy. We'll do our best. It doesn't look like we may be able to reach it.
This is a regular sight in the north, but at least this woman is in Tamale. But what about other women in villages like Acquaah? Would the seat of a motorcycle be appropriate for a woman if she went into labor at midnight? Or would she call the traditional birth attendant just a hut away from hers?
Our facility has a vehicle, but the government maybe cannot get transportation for every pregnant woman at home. It's now left with the pregnant woman and her people to plan on how to come to the facility. When they come for antenatal, we tell them.
We are trying to get the community health officers to be trained in midwifery so that the women can be seen closer. Anything also can happen in pregnancy. You may be very fit. You may have had some children before, but every pregnancy is different and can run any risk.
At least Tadali did not add to Ghana's grim maternal mortality figures due to our timely intervention. Hopefully, more women in rural areas will get access to proper transportation to health centers. Efua Acquaah-Harrison, TV3.